Welcome to the Maxi Sky 2 Plus demonstration video. This guide is designed to provide users with an overview of the product, as well as some guidelines on its correct use. In each of the sections that follow, you'll be guided through the key features and functions of the Maxi Sky 2 Plus, including sling insertion, transfer from bed to chair, lateral transfer, limb support, bed repositioning, bed turning, key control features, and dual and single mode conversions. For more information on a specific feature or procedure, you can choose to navigate directly to the most relevant section by clicking on the appropriate title in the Contents menu. Always read the Instructions for Use manual before using the product. Transfer from bed to chair. In this section, we look at how to use the Maxi Sky 2 Plus to transfer a patient from bed to chair using the Maxi Slide. This procedure requires 3 healthcare personnel, 1 sling and 2 sliding sheets. It is important to ensure that the proper ergonomic working techniques are utilised at all times to avoid injury. For further details, please refer to the Instructions for Use manual. Maxi Slide insertion. Make sure that the bed is at the correct working height and that the bed rails are lowered. To make the process easier, it is advisable to raise the head of the bed slightly. Using the proper ergonomic procedures, roll up the 2 sliding sheets in preparation for use. Place the rolled sliding sheets just underneath the patient's head, with the folded section of the Maxi Slide facing down. Creating as little friction as possible, carefully insert the Maxi Slide underneath the patient using the unravelling method. You are now ready to insert the sling. Sling insertion. Take the plus-size sling and insert it carefully between the 2 sliding sheets. A caregiver stationed at the head of the bed should help guide in the sling uniformly. Gently work the sling down between the sliding sheets until the bottom edge of the sling is level with the top of the patient's buttocks. Carefully remove the top sliding sheet by flipping it backwards to avoid friction and pulling it from underneath the patient from the foot end towards the head end, using the natural curves of the body to assist you. Attaching the leg straps to the ceiling lift. Position the lift above the patient. Press the sit button on the hand control to lower the spreader bar for loop insertion. Attach the relevant loops on the sling straps to the hooks, ensuring the spring-loaded latches close properly. It is best to attach the leg straps followed by the shoulder ones. Lifting the patient. With all straps securely attached, press the up button on the hand control to raise the patient's trunk. Then, press the recline button to raise the patient's legs. Do not raise the patient higher than your eye level. Proceed with the transfer, making sure that the patient is comfortable. Lowering the patient into the chair. When the lift is aligned with the chair below, press the recline button to adjust the patient's position from lying to sitting. Slowly lower the patient into the chair. As the lift comes down, ensure the spreader bar does not hit the patient, as this could cause injury. Removing the lift and sliding sheets. When the patient's body weight is fully supported by the chair, detach the leg loops, then the shoulder loops from the lift. Carefully move the ceiling lift away from the patient and fold up the sliding sheets. Make sure that the patient is comfortable and, if appropriate, remove the sling sheet from behind the patient. For further details, please refer to the Instructions for Use manual. Transfer from chair to bed. In this section, we look at how to transfer a patient from a chair or a wheelchair to a bed using the MaxiSky 2 Plus ceiling lift. This procedure requires 2 caregivers, 1 sling, and 2 sliding sheets. Please ensure that the proper ergonomic techniques are utilised at all times to avoid injury. For further details, please refer to the Instructions for Use manual. Prepare sliding sheets and position lift. Lay out a sliding sheet on the bed where you plan to place the patient. A second sliding sheet, such as a MaxiSlide or MaxiTube, can be added where necessary. If required, place the sling around the patient so that the base of the sling sits well below the coccyx. Maneuver the MaxiSky 2 Plus ceiling lift into position above the patient. Using the hand control, lower the spreader bars just above the patient and close enough to attach all the relevant loops on the sling straps. Attach sling to lift and lift patient. With the shoulder loops and then the leg loops of the sling connected to the spreader bars, make sure that the spring-loaded latches close properly. Using the up button on the hand control, raise the lift enough to take the patient's weight. Then, raise the foot end of the spreader bar, first using the recline button. Once the patient is in a comfortable reclined position, raise the lift again to the desired height, no higher than necessary. Transfer patient to bed. Proceed with the transfer, ensuring the spreader bar is kept steady to prevent excessive swinging. When the ceiling lift has reached the desired location, begin lowering the patient down onto the bed or trolley using the hand control. Be careful to avoid the spreader bar hitting the patient as the lift lowers. Removing lifting equipment. When the patient's body weight is fully supported by the bed, detach the leg loops, then the shoulder loops. Carefully raise the bed rails, adjust the bed height where necessary, and move the ceiling lift away from the patient. Remove the sling from underneath the patient. Lateral transfers bed to bed. In this section, we look at how to do lateral transfers, that is, from bed to bed or bed to trolley. This procedure requires 2 caregivers and 1 bariatric repositioning sling. Please ensure that the proper ergonomic techniques are utilised at all times to avoid injury. For further details, please refer to the Instructions for Use manual. Preparing the patient for transfer. Place the patient onto the repositioning sling and remove the footboard. Attach the loops of the sling onto the hooks of the spreader bar, starting with the shoulders, followed by the legs. Lifting the patient. Using the up button on the hand control, slowly raise the patient above the bed until they are fully supported. In some cases, you may wish to provide additional support for the head. Pay attention to the angle of the sling. It needs to be level or the patient may slide out of it. Transferring the patient. When raised to the required height, move the patient over onto the adjacent bed, making sure that they are positioned centrally over the new surface. Be sure to follow ergonomic practices at all times to avoid injury. Keep the spreader bar steady to avoid swinging. Lowering the patient onto the new surface. Once in position, press the down button on the hand control to lower the patient onto the new bed. Lower the spreader bar further down and detach the sling loops. Make sure the patient is comfortable and securely positioned to avoid any risk of falling off the new surface. Once the sling has been loosened, raise the spreader bar and move the ceiling lift away from the patient. Where required, remove the sling using a slider sheet if necessary. For further details, please refer to the Instructions for Use manual. Limb support. In this section, we look at how to use the MaxiSky 2 Plus to support a limb for procedures that require limbs to be secured in elevated positions. This procedure requires one caregiver and one limb sling. Be sure to follow the correct ergonomic procedures to avoid injury. For further details, please refer to the Instructions for Use manual. Elevating the limb of a patient. To elevate an arm or leg, place the limb sling around the patient's limb. With the ceiling lift in position, connect the loops of the sling to the spreader bar. Using the hand control, raise the patient's limb until it is at the desired height, being careful not to overstretch the limb. Place the control back on the lift. Make sure the patient is comfortable and that the tension on the hooks is even. Bed repositioning. In this section, we look at repositioning a plus-size patient upwards or downwards in a bed. Ideally, this procedure should be carried out by 2 caregivers using a bariatric repositioning sling. Use a MaxiTube sliding sheet under the patient's feet if needed. For further details, please refer to the Instructions for Use manual. Repositioning a patient. To reposition a patient, place them in a repositioning sling. Once the loops are in position, gently raise the ceiling lift using the up button on the hand control. The patient should be raised until their hips and upper body are supported, and it is possible to move the patient up or down in the bed. Pay attention to the patient and make sure that extremities such as the head or feet do not need extra support. Slide the patient up or down using the ceiling lift runners. Once in position, lower the patient back onto the bed using the down button on the hand control. Make sure the patient is comfortable before removing the sling and the ceiling lift. Bed turning. In this section, we look at how to use the MaxiSky 2 Plus to turn a patient in bed. Make sure that the bed frame is flat and not inclined before attempting to turn a patient. You may also need to move the patient sideways first to create sufficient space for you to be able to turn them. Ideally, this procedure should be carried out by 2 caregivers using a bariatric repositioning sling. When in doubt, always follow the correct protocols laid down by your healthcare facility. For further details, please refer to the Instructions for Use manual. Having placed the patient onto a sliding sheet on one side of the bed, connect one side of the repositioning sling to the foot end of the spreader bar. With one caregiver on each side of the bed, simultaneously raise the spreader bar using the recline button on the hand control and pull the sliding sheet until the patient is turned into the appropriate position. Make sure the patient is comfortable before removing the sling and the ceiling lift. Do not forget to raise the side rails after the procedure. Key control features. In this section, we look at the key control features of the MaxiSky 2 Plus. For further details, please refer to the Instructions for Use manual. Emergency stop cord. In the event of an unexpected event, simply pull the red emergency stop cord. To reactivate the ceiling lift, simply push up on the red plunger and wait for the machine to reset. Hand control, tilt function. The MaxiSky 2 Plus is equipped with a patient tilt function. Using the hand control, press and hold the recline button to tilt the patient into a lying position. Press and hold the sit button to bring the patient up to a seated position. Hand control, Information button. Press the Information button for 4 seconds to access the menu. From here, you can access a number of different user statistics, including battery information, total number of lifts, lifts performed on the previous day, lifts performed the previous week, and average lifts per day. Hand control, battery information. The amount of charge remaining in the battery is shown by the battery icon. The bars indicate the remaining battery life in increments of 25%. 100% is fully charged. 75% down to 50% charge is the normal operating range. 25% charge is low and is accompanied by a short beep when any buttons are pressed, except the information button. Less than 5% charge is critical. Icons alternate, accompanied by 2 short beeps every 10 seconds. Hand control, menu navigation. Use the up and down arrows to navigate in the menu. Use the back button to exit the current screen. Choose Monitoring to access usage statistics. The Customizing button enables you to alter a number of settings, such as motor speed, strap length, detection time, ready state, hoist LED indicator, as well as the date and time. In this menu, you can also switch between single and dual operating modes. The mode you use depends on the weight of the patient and which task you wish to carry out. Single mode is for patients weighing up to 272 kilograms, while dual mode is for patients weighing from 159 kilograms to 454 kilograms. We recommend that you consider using dual mode for patients over 159 kilograms for ease of use, comfort, and performance. To exit the menu, use the up and down buttons to find back. Then press the information button on the hand control until you reach the battery icon. Hand control, dual to single mode configuration. Lower the 4-point spreader bar down onto the Maxi Sky 2 cart. Unbuckle the 2 straps from the spreader bar. Attach any suitable spreader bar for single-use mode. Raise the spreader bar and the empty strap all the way to the top. It is very important to ensure it is raised to its maximum height. Push and hold the information button on the hand control for 4 seconds to enter programming mode. Use the up and down buttons to find customizing mode and push the information button to select it. You are now in customizing mode. Use the up and down buttons to find dual mode and push the information button to select it. Use the up and down buttons to find single mode. Push the information button to select it. Once selected, use the up and down buttons again to find back and push the information button to select it. Maxi Sky 2 Plus is ready to be used in single mode. Hand control, single to dual mode configuration. Raise the spreader bar in single mode all the way to the top. It is very important to ensure it is raised to its maximum height. Push and hold the information button on the hand control for 4 seconds to enter programming mode. Use the up and down buttons to find customizing mode and push the information button to select it. You are now in customizing mode. Use the up and down buttons to find single mode and push the information button to select it. Use the up and down buttons to find dual mode and push the information button to select it. Once selected, use the up and down buttons again to find back and push the information button to select it. You are now in dual mode. Lower both the straps, and since there is no weight on one of the straps, use the white plastic strap puller to apply pressure on it while lowering them using down button on the hand control. Remove the spreader in single mode and replace it with the 4-point spreader bar for dual mode. Before you finish, we hope you found this demonstration video helpful. If you need more information, please refer to the Instructions for Use manual. If you feel you still require further training, please contact your line manager as soon as possible to discuss. Thank you for your time.